the membrane that connects the container of the heart to the lungs?
Varus pericardium.
Okay. That leads us to deep to that is the serous membrane. Okay. What's its outer layer? What would this be then called? We call also known as we call the deep layer of this membrane. Visceral one. So the epicardium is the visceral pericardium. Any questions? All right, everyone understand apex base. Anterior surface, we look for the pulmonary trunk and the auricles. Posterior surface, we look for the left atrium and the coronary sulcus, which contains the largest vein of the heart. Question today's game.
Coronary sinus.
Coronary sinus. All right. Other surface details. Okay. Right between the auricles is the pulmonary trunk. It divides into the
right and left coronary
arteries, carrying
the oxygen
to the lungs. Coming back are these four red guys.
Right and left coronary veins.
Carrying
oxygen
blood. So
back to the
we
blood.
can mix and match here a little bit. All right. Let's see what else we got. All right.
What are those?
Right and left coronary arteries, we'll get to that, are the only branches off the ascending aorta, and you can see them clearly, the little red knobs. This would be the right coronary artery. This would be the left coronary artery. And you can see them continuing around the auricles. There's the faceplate back in, somehow, some way. And this is the anterior interventricular sulcus. It contains the anterior interventricular artery and the great cardiac vein. This is the posterior interventricular sulcus, containing the posterior interventricular artery and the middle cardiac vein. So the three veins that feed the heart are the middle cardiac vein,
coronary
sinus, and the
greater
cardiac vein. Other branches of the coronary artery are the circumflex and marginal arteries. So that's the blood flow. Other structures you see here are the superior vena cava and the inferior vena cava. What would this be? Brachiocephalic vein. Thus, when we get to the aortic arch, we have three branches in order.
Brachiocephalic
artery.
The
same thing we did over here. Left common carotid artery. Left subclavian. Brachiocephalic, left common carotid, left subclavian. Just like we saw in this plot. Okay? We can all recognize the pulmonary trunk and arteries, pulmonary veins. Superior and inferior vena cava, brachiocephalic, and the branches of the aortic arch and the ascending aorta.
Brachiocephalic, left common carotid.
That's surface detail. Left subclavian. We remove the faceplate. We see internal features. Everyone should be able to tell auricles, atria, and ventricles. Anyone not be able to do that? Can anyone not tell the right and left atria? Can anyone not tell the right and left ventricle? What's the name of the wall that separates the two ventricles? Okay, which contains myocardium and it's lined with endocardium on either side. What do you call this irregularity of the endocardium and the ventricles? Trabeculate carnate. What do you call these little muscles? What do we call the strings?
Heartstrings.
Carnate tendinate. And they attach to both valves. Name that valve. Another name? Okay. Okay, then we've got this valve.
Seminary, semilunar.
Pulmonary, semilunar. Aortic, semilunar. Okay, the closure of which of these two valves gives us the first heart sound, the lung?
The closure? Which one?
AV valves. When the AV valves close, the blood hitting them and becoming turbulent, we interpret as the S1. Okay, which of the closure of which valves would we interpret as the S2 sound? The done. Semilunar. There's only 4 valves in the heart. So when these two shut, S1. When these two shut, S2. You gotta understand what we're doing now. It's tricky. We're talking about valve closure sounds versus the cardiac cycle. Valves opening and closing, blood going where it's going. It's two different things. All right. Let's see. What do you call the muscles that are inside the auricles and the atria? They supercharge. Close. Pectinate. Pectinate. All right. If you look closely inside of here, you'll see a little white loop. It's a little white loop. You see that? That's the SA node. That's to represent the SA node. You see this other loop down here?
SN?
AV node.
Oh, AV.
Those are the two parts of the conduction system visible here. The rest they don't show. Right here would have been the AV bundle. The bundle